Good afternoon. My name is Corey Tkach. I'm a commander of operations within Peel Regional Paramedic Services. So upon our arrival of the crash site, our staff were faced with multitude of different injuries, mainly stemming from back sprains, head injuries, anxiety, some headaches, nausea and vomiting due to the fuel exposure. So those were the common sort of injuries that we had come across. On the initial assessment in any mass casualty incident, we do a triage of patients. And yes, some patients were deemed to be critical at that time. And we make that assessment based on our initial contact, what the patient's complaining of, the fact that they were involved in a plane crash. And some of those determinations happen quite quickly in the short amount of time that we spend with that patient to ensure that they're receiving the quickest care possible. And there are times when further care occurs and those conditions get downgraded. So from critical to like serious and non-life threatening. There are times in scenarios like this where somebody may be complaining of like abdominal pain or a head injury, and we may err on the side of caution to deem them critical because we can't see inside their skull, we can't see inside their abdomen, but based on some of their vital signs and other determining factors, that's when sort of the decision to make them a critical patient would have occurred.
So in terms of like the acuity of injuries, perhaps the most acute would be that like the back sprain or the head injury possible.
Yeah, a head injury from an acuity state is obviously very dangerous. The issue is we obviously can't see inside the head at that time, right? So.